Welcome to this special episode of Decoding Gender Insights from Thought Leaders. Population First is observing the 16 days of activism against gender based violence, a global campaign from November 25th to December 10th, with a 16-part podcast series that delves into the intersection of gender and critical social issues. Since inception in 2005, Population First has focused on challenging the gendered attitudes that devalue girls and women, fuel discrimination, and perpetuate gender based violence. Gender and health in India are influenced by societal norms and economic disparities, with women facing unequal access to care due to patriarchy and financial dependence. Issues like malnutrition, maternal mortality, and stigma around mental health and gender based violence are prevalent, especially in rural areas. While intervention and empowerment initiatives are gradually advancing gender equality in health, India still has a long way to go. Joining us in today's episode to shed light on this critical issue are two distinguished experts. One of India's leading obstetrician and gynecologists, Dr. Sudeshna Ray, is known for her women-centric approach, while Shumita Pal, a career journalist who has tracked the health beat for 15 years, unfailingly weaves in gender into her work. Over to the experts.
In India, a significant gender health gap persists, where women has been facing greater barriers to access healthcare services compared to men. There are various factors like the cultural norms, socio-economic disparities, limited autonomy contribute to the disparity that we are seeing between the gender. Women often experience delay in seeking healthcare. There is inadequate prenatal maternal health care and high rates of malnutrition and anemia. So while in India, the government has been doing a lot in terms of maternal mortality, bringing down the maternal mortality numbers, and we have seen the numbers coming down. The maternal mortality rate has come down. But at the same time, we are seeing a rise in non-communicable diseases among women. And if we see the numbers, percentage wise, compared to 2019, there is 53.5% of female deaths that has happened, which is like 33% more than 2000. Cardiovascular diseases, cancers, and diabetes among women are on rise. The gender health gap is more than just a women issue, if you see, because it doesn't affect the women alone, but the family, the community at large, the workplace, and the society. Yet, we are seeing not just in India, globally, millions of women at all stages of life are unable to access healthcare, treatment, and support that they require. The other concern in terms of women health is conditions like premenstrual syndrome, depression, gynecological diseases that are restricting women's contribution majorly to the country's GDP growth. Dr. Sudeshna, we have been talking about financial independence, like many women are now financially independent. But this disparity in seeking healthcare, is it only restricted to rural, or do you see this in the urban setup also? What is your experience in your 25 years of career as a gynecologist?
At the outset, thank you very much for making me a part of it. And it's always my favorite subject because I always feel that in healthcare, uh, there is a gap which needs to be addressed. And I'm at the forefront, like, executing my profession, my professional advantages to do something about it. So this is definitely a topic which is close to my heart. Now, coming to your question of does it still exist? Does it exist in a rural or urban area? I would say we have come a long way, especially in the urban areas. We have come a long way thanks to the financial independence that you've spoken about, thanks to the social media, thanks to women who are successful in their careers and talking about self care, talking about healthcare, their own healthcare. So we have come a long way. However, there is a big gap that needs to be addressed, and that the reason are multi-layered, multifold, coming from the woman herself, the attitude of the woman herself, the attitude of the family towards the importance of our health, the attitude of the society as a whole, and finally the attitude of the healthcare worker also play a very important role in all of this. So,
So this
um,
is where something I would like to also mention, like while reporting, when we do the organ donations, live organ donations, we see many women when they are asked, they immediately agree. So number of women live donors are more compared to men. When they are the seekers, when they are the recipient, we see hesitant from the family. So, and also we see when it comes to caregiver, they are at the forefront. So, yeah, this is one of the observation, and we also see that there are delays happening. Where women still come at a later stage. Uh, so that is one thing when you say
yeah,
about the attitude.
right. So the same thing applies here. The woman is not made to feel important from the
Mhm,
childhood, as a girl, and as a woman she doesn't feel herself to be important. The attitude comes from there. So I am not
mhm,
important, my health is not important, my health comes at the bottom of the priority. First is my husband, who is the breadwinner of the family. Even with financial independence, the like inherent, the imposed uh, attitude is that
mhm,
you are the least important of the family.
mhm,
you know so when it comes to organ donation, because the man is the breadwinner of the family, even if there is a substantial contribution by the woman, she's always made to feel the least priority as far as health is concerned. So
mhm,
of course it is changing. I would not say that it's there, especially in urban areas. With education, with financial independence, it is changing, but that it is still there. So that is the attitude that the woman is brought up with, and that attitude comes that you know there's a lot of guilt, even in,
mhm,
I mean, you're talking about organ donation, I'm talking about simple things like taking rest after a procedure. So whenever of just about a week back, there was a family where the woman needed a procedure for which she needs about 2 weeks rest, and the entire decision of the procedure was taken based on when would someone come and take care of
mhm,
her from her own family, like a
mhm,
mother, like a sister. But not, she has a daughter, she has a son, she has a husband, she has the in-laws, but they
mhm,
are not ready to take care. So the entire decision of the procedure was taken, when can one come from her family to come and take care of herself, her you know
mhm,
so that saddens, that is sad. you know you still feel that the woman who is the center of the care for the entire family gets the last priority when it comes to her own health, and it is made to feel it's, maybe she's, again, something which is there inside her, or the society gives it to her, that she feels guilty to take care of herself. She feels that she will be labeled as selfish if she is
mhm,
taking self care. Whereas whereas for a man, his health come at the topmost priority.
mhm,
So this is the attitude of, I would say, the woman herself, and as I said, the family, the society, and the healthcare worker. Now, the healthcare worker attitude is a completely different thing. It is not nothing related to this, but healthcare workers sometimes feel that the complaints that the women have is a lot to do with her psychology, is a lot to do with being functional, is a lot to do with her emotional thing. So whenever it's very easy, it's easier. I would not say very easy. It's easier to label a woman having pain as something which is, uh, you know, maybe it is a lot of stress. It's a lot of psychological thing that she's undergoing. And that's why she's having pain rather than going into a deep organic cause. Even if there is a psychological element to the pain, you cannot separate mind from the body. If you have to treat a body pain, you have to also treat the mind. So I think as healthcare workers, we also have to change our attitude towards, probing into the emotional aspect of the complaint that she has. That would bring more and more women forward to talk about their problems, to talk about their health problems.
So, we were talking about this patient of yours who's doing a procedure dependent on the family's availability. We also had discussed about her decision making, like when a patient comes to you for a C-section or a normal delivery. How you had mentioned once that it is not her decision. Generally, it involves the in-laws, the extended family. uh, when it comes to women's health, she doesn't have, it's just not restricted to the, we talk about the womb right, but it's even simple decision making of a C-section or a normal delivery is not in her hands.
Right. So, of course, in the last 25 years of my practice, I would say that in the last 5 years, I am seeing a big change. But again, saying that the change comes with um, with the financial independence. Change comes with the women empowerment. It doesn't come just like that. So we still see families where women are not financially independent. The decision is taken by the uh, by the husband, by the father, by the parents, by the parents-in-law. So I remember it's a very funny thing, and this is social gathering that I'm talking about. I remember a father-in-law boasting. I think I have spoken to you about this incident. A father-in-law boasting
Yeah.
about in a social gathering that after my daughter-in-law gave birth to the second child, मैंने तो बोला था बंद करवा दो. And I was like, I didn't have words to express the anguish that I had. How can a father-in-law take that decision? मैंने डॉक्टर को बोला था जाके बंद करवा दो. So these are things which, whether something needs to be done or whether something needs to be undone or whether something needs to be not done, the decision sometimes is taken by everyone else other than the woman. Simple things like taking an epidural during a labor pain. That also, with that kind of a pain, I've seen women, looking out for the husband's approval, looking out for the mother-in-law's approval. These things are still prevalent, and these are still prevalent in families where the woman is financially independent. So the decision-making ability also has to be inculcated from the very childhood, I think. The confidence in that woman that yes, you can take a decision about yourself, that should start from the childhood. And then only how much ever I feel that, how much ever I try to empower that this is the woman, I tell her that, it's your body, it's your choice, and it's your decision to go ahead with this. You don't have to take anyone's approval. That is not taken very well by the family. Often I've
Mm.
lost patience because of this, that, but I don't stop myself. I think as caregivers, as women in authority, if we can't insist on these things, then who will?
Mhm. Mhm. So there is
So,
this report. Yeah, sorry.
no, no, please go ahead.
Yeah. So there's this McKinsey company report which talks about approximately only 1% of the healthcare research and innovation is invested in female-specific conditions beyond oncology. There's a very little research being done when it comes to female women, and this is something you also had shown concern about. The physiology of women and man is different, and how there is least research done, how it affects, and how this is a major problem in gender uh, healthcare thing.
Yeah. So, uh, whatever we are seeing now as modern medicine, a lot of it is based on male research, but
Mhm,
there are certain things, of course, the gynecological things which are exclusive to women, like a period
mhm,
problem, like a fibroid, like an endometriosis. So these are things which are very specific to women, and there are enough research which is happening now. um, in the last, say, about 2 decades, things have been more on the improvement side, but there are also things which are differently expressed in women, like a migraine, like osteoporosis, like a problem which is there equally in men and women, but their expression finds a different uh, magnitude, or a different character in women.
mhm, mhm,
So in that space also, I think there is still a long way to go. Research
mhm,
is improving, but we still have to have more and more women taking part in research. So I think women need to be volunteers. The
mhm,
company, the pharmaceutical companies, the healthcare industry, the research industry should be more pro taking women
mhm,
uh, into account when they are researching for something.
mhm,
There has to be a 50-50 population,
mhm,
like distribution, so that we can come up with solutions which are particularly tailored for women. They so far the situation so far the solutions that we are bringing is largely based on the male physiology, the male anatomy, the male
mhm,
expression. Recently, very recently, about a decade, 2 decades, maybe 1.5 decades back, we are recognizing the fact, people like research agencies like MAC is coming up with the fact that men's physiology is different, and we need to have something which is specific to women, and not just get away with the thing that, oh, this is a problem and this is the solution. There cannot be a two-way to it. We are finding uh, more inclination towards, more, I would say, not inclination, I would say the kind of urge or eagerness of these research companies to have women, more and more women volunteers, and that that is the need of the hour.
mhm. So this is a little away from the gender gap, but a very important thing, privacy.
Mhm.
So 2 years back, this incident had happened at one of the renowned corporate hospital in the eastern suburbs, where this woman had gone for a health checkup, and she had faced the privacy issue. The person, the ward boy, just came into inside while she was not appropriately dressed. So we women do see this privacy issue both in the more in the public hospitals, and it's not just paid much attention. Can you just touch on this point also? Because I think, I mean, when it comes to gender thing, we have issues on this front also.
Yeah, of course. I mean, as caregivers, as caregiving institutions, all hospitals,
Mhm.
whether it is a public or a private, they have to be sensitive to a woman being examined versus a man being examined. I mean, there's a lot of difference. A woman being examined, even for, it doesn't matter whether it's examination of the breasts or genitals, even if she is being examined for a chest issue, or even if she's being examined for something in the torso or in the legs. These are things where women do not want to expose in front of others. So there has to be certain sensitiveness around it. And most of the hospitals have it. So they have a private area, which is, either a curtained out area. And if a male doctor is examining the woman, there has to be a nurse, female nurse, or a female doctor who's accompanying that male doctor, so that
Mhm.
the woman herself, I mean, it's not that uh, the doctor's attitude is wrong, but the woman will feel much more comfortable if there's a woman around her. So, and it is also legally, you know I think legally needed, that you need a woman while examining a woman. So that sensitiveness, I have seen women not being comfortable even with the family members, even with the husband. So
Mhm.
sometimes they ask the husband even to go out of the room. They do
Mhm.
not want to express their uh, discomfort while being examined. They do not even want to express that in front of uh, the man that she stays with, or any of her friends, or anyone who's there in the room, even if in the curtained out area. So yes, as healthcare workers, we have to be sensitive. As institutions, we have to be very sensitive to this fact. In fact, we are constantly telling our ward boys and even sisters that for the new mothers, especially, or for anyone, any woman who is staying, like an indoor patient who is staying in the hospital, to knock the door and wait for some time before barging in, because sometimes they just knock it for the sake of knocking and then goes in. And a mother may be nursing a little newborn, or changing something which she's in a little awkward position. So we have to be very, very sensitive. And the poor boy is just coming and delivering milk, I mean, or delivering a food. But you have to be like imbibing or instilling that sensitiveness in forms of training, in forms of telling that this is what you need to do. You need to knock, you need to wait, you need to give them some time, and then a few seconds. I mean, it doesn't take long. But if the woman is alert,
Mhm.
if you're talking about that incident, uh, I think she was undergoing a sonography, or she was undergoing an examination
Yes,
where the
yes.
ward boy uh,
ECG.
comes in and asks something different. So
Mhm.
it is not that the ward boy came for with a different attitude, just came in to ask something. And
Mhm.
that's something which we have to be all very sensitive about.
Mhm. So,
Respecting the
Doctor.
privacy,
Mhm.
uh, respecting her vulnerability. When she's being examined, any part of her body, she's
Mhm.
vulnerable. So we have to give her utmost respect to that
Mhm.
vulnerability, and try to uh, assure her that she is safe.
Mhm. So with we have now seen the NCDs going up, cardiovascular diseases among women going up. In Government of India is also concentrating more on NCDs. Um, so preventive healthcare is being focused on, and we also are seeing at the same time we are seeing that women are still not paying much attention. What, according to you, are things need to be done to bridge this gap, gender gap?
So this is something which I would say a lot of the responsibility, give a lot of responsibility to the woman herself.
Mhm,
I'm talking about uh, this comes with an awareness, because the symptoms of cardiovascular disease is different in a woman than a man.
mhm,
How would she
mhm,
know it? We are
mhm,
saying it on different social media
mhm,
platforms. We are calling people for talking about them. We when I go to different corporates to talk about women health problems, and um, not only
mhm,
gynecological, I bring in experts from the other fields also to talk about them. When we address a
mhm,
woman audience, only women audience, when we are expecting 100 women to come and
mhm,
join us for that talk, I see about less than 50% attendance in that. Whereas when I'm addressing a bunch of men, if I'm
mhm,
expecting 100, I would see a 300.
mhm,
I don't know how this attitude comes, that women always feel that I would deal with it when it comes. Whereas
mhm,
prevention, I think men are more prone to a preventive uh, gear up.
mhm,
So we have to change ourselves as women. We have to change ourselves. We have to change our friend. We have to change our family uh, in terms of giving importance to preventive health. We have to be aware of what things are going on. We
mhm,
also have to take some mandatory checks. So the roadblocks in mandatory preventive health checkup in women are, if something comes up, then what's going to? So they are
mhm,
so scared about if something comes up. Whereas in a man, I've never seen that fear. A man goes
mhm,
boldly, yes, I have to find out what's wrong and we can deal with it.
mhm,
Women inherently have this uh, inhibition in them, that what if something comes up? So we have to tell as caregivers that, it's good that something comes up, and we can nip it at the bud. So
mhm,
so sometimes they feel upset that, I did this, and then as if it's the it's a fault of the preventive health checkup that we picked up something. They fail to
mhm,
appreciate the fact that, uh, because of this, I have picked up something which I needed to. So this attitude should
mhm,
change. And again, the woman has to be made to feel important. Otherwise, this gap is going to remain. So the woman herself should feel important. The woman should be made to feel important by the family, by the society, by the community. Only then I think we can expect more and more women in seeking adequate health care.
Thank you, Dr. Sudeshna Ray and Sumita Pal, for the insightful and thought provoking conversation on gender and health. Viewers may share their reactions, queries, observations, and more in the comments section below. Please watch all the episodes and initiate gender conversations with your family, friends, colleagues, and community members.